The US government is gearing up for one of its biggest tech transformations ever. The Department of Health and Human Services, or HHS, has just rolled out a massive new strategy, and it's all about using artificial intelligence to supercharge public health. And believe me, this isn't just some minor update. It's a plan for a complete and total overhaul.
And they are not being shy about their goals. This quote from the Secretary of Health and Human Services pretty much says it all. They don't just want to use AI, they want to become the gold standard for the entire government on how it's done. That's a really big statement. Okay, but saying you're going to do something is one thing. Actually doing it is a whole other ballgame. How does a gigantic government agency turn itself into an AI-powered machine? What's the actual blueprint here? Well, that's exactly what we're about to break down. All right, so first things first. To really get what's at stake here, you have to understand the sheer scale of this ambition.
You know, when you read their official strategy, the vision is huge. We're not just talking about making government paperwork run a little smoother. No, this is about using AI to fundamentally improve health outcomes for every single American, from top-tier biomedical research all the way down to your doctor's visit. So, why go through all this trouble? Why such a massive change? Well, to get the AI solution, you first have to understand the problem they're desperately trying to solve. And this quote from the HHS Deputy Secretary really paints a clear picture, doesn't it? Basically, they feel like they're drowning in bureaucracy and paperwork. You've got these incredibly smart, productive people who want to do great work, but they're just stuck. In AI, that's their ticket out. That's how they plan to cut through all that red tape. Yeah, this really captures the whole before and after idea perfectly. On one side, you've got the old way, slow, fragmented, just buried in paperwork. And on the other side, you have the vision for the future. Fast, efficient, united. They want to go from being bogged down to being totally supercharged. Okay, so we've got the problem and we've got the grand vision. Now for the most important part. How are they actually going to do it? Well, the whole strategy is built on this 5-part blueprint. So this is basically their game plan, the heart of the whole thing. Think of it like building a house. First, you got to have trust and the right rules. Then you build a foundation. That's the tech infrastructure. Then you train the people who are going to use it. You make sure the work they do is absolutely top-notch or gold standard. And all of that comes together to totally modernize healthcare. So let's dig into each one. All right, Pillar 1, governance and trust. This is super important. Before they go full steam ahead, they're laying down the ground rules. This is all about managing risks and being totally open about how they're using AI. They're even going to keep a public list. They know they have to earn public confidence right from day one. Next up, the tech, the nuts and bolts. Instead of every little part of HHS building its own separate tools, they're creating one central hub, a commons as they call it. The logic here is pretty simple, right? Let's share our data, share our tools, share our computer power, and let's prioritize American and open source tech so we're not constantly reinventing the wheel. And I think this next part is really interesting. It's not just about the fancy new machines, it's about the people. This whole pillar is about getting the workforce ready. We're talking training for literally everyone. And get this, they want to give them AI co-pilots. You know, little assistants to handle all the boring, repetitive stuff. The goal is to free people up to actually innovate and try new things. Okay, Pillar 4 brings us back to the core mission, science. This is where the rubber really meets the road for health. The big goal here is to make sure that any AI they use in research is absolutely top tier. It's got to be gold standard. That means transparent methods and reproducible results, all to speed up real, trustworthy discoveries.
So yeah, when you hear them talk about gold standard science, this is it. It's not just a buzzword. It means the research is solid, it's open, and anyone can check their work. It's basically the bedrock of doing real science in the age of AI.
And that brings us to the 5th and final pillar, which connects everything back to you and me, the patient. This is the payoff. All this work is meant to directly improve our healthcare. Think about AI tools that help your doctor make a better diagnosis, or find better treatments for things like cancer, heart disease, and diabetes. This is where it all comes together.
Now, I know what you might be thinking. This sounds great, but it's probably years away. Well, here's the kicker. It's not. This is already happening. HHS is already on the move, and they are moving fast. I mean, let's just look at the numbers. This fiscal year alone, HHS has 271 active or planned AI projects. 271. That's not a someday plan. That's what's happening today. They're already doing this at a huge scale.
And hold on, because that number is about to go through the roof. They're projecting a jump of almost 70% just in the next year. This isn't a slow ramp up, it's an explosion. The acceleration is happening as we speak.
And we're not just talking about some vague projects on a spreadsheet. These are real tools being used today. Every single employee has access to things like ChatGPT. Scientists are using game-changing AI like AlphaFold to map out proteins. They're speeding up how they review grants, and the CDC is using AI to spot the next health crisis before it happens. This stuff is everywhere.
All right, let's bring this all home. All these pillars, all these projects, they're all building toward one big idea, one unifying concept for the entire department. And that big idea is what they call One HHS. This is really the North Star of the whole strategy. It's about taking this massive, sprawling government department and finally getting it to act like a single coordinated team when it comes to technology and data.
So what does that actually look like? Well, it means the CDC can easily talk to the FDA, which can easily talk to the NIH. No more information stuck in silos. It means data and ideas can flow freely. It's all about using AI to get everyone on the same page, working together toward that one big goal of a healthier nation. And that, of course, brings us to the biggest question of all. HHS has this incredibly bold, ambitious plan. They've laid out the blueprint to turn this giant agency into a fast-moving, AI-driven engine for public health. The wheels are already turning, but the fundamental question remains, will it work? Will an AI-powered government truly lead to a healthier America?